Do you suspect substance abuse in your family? How do you even talk about that? What to look for. How do you know your loved one is using substances? Let's look at the different physical features that change with substance use. Dilated pupils, bloodshot eyes, eating habits change. They're tired all the time. Their speech is slurred. They're restless, almost like anxiety. A change in hygiene, rapid weight gain or weight loss. Change in sleeping, maybe nervous energy, and avoidance and isolation. Emotional and mental changes and other things to look for would be hostile behaviors from someone who's normally calm. Talking back from those previously didn't talk back. Isolation and avoidance again. A lot of times with substance abuse is a lot of spending time alone, not wanting to be in a crowd of people, not wanting to be around family, where previously they were around family all the time. Depression and anxiety with those who didn't previously show these, and a lack of focus and concentration. Defiant behaviors is the most common, as well as complete isolation. Verbally aggressive, talking back, physically aggressive, where they're normally, you would look at them and not even think that they would be physical at all. How about school skipping? A drop in the school grades where they're normally focused on their future, focused on grades, focused on a better life, and mood swings. Any change in previous behaviors that you feel are out of the norm. So what do? Most times a person confronted will not admit to using, out of guilt, shame, or feeling like they're being targeted. The conversation should be in a neutral environment, a calm space. This should not be done in front of siblings or other family members, as it causes embarrassment and more guilt and shame. The person is not going to say, hey, yeah, I use drugs, or hey, I tried it with my friends. If they're sitting in front of other family members, you're putting them on the spot and making them feel uncomfortable. So how do you start this conversation? Tell the person how much they mean to you. Don't give them this candy-coated version of, you mean the world to me. Be normal. Be as normal as possible, opening up yourself as well as wanting them to open up to you. Tell them what you have noticed with changed behaviors and communication levels. Show them some concern. Let them know they can talk to you about anything without feeling judged. This is the important part. Do not judge them or yell or show disappointment. It is not time for that yet. Don't put them on the spot of saying, I know you're using, if you're not really sure. Start asking them questions. Ask them to explain how they've been feeling and what, if anything, has changed in their lives. Ask what they feel they are struggling with. This opens a conversation. Remember to use open-ended questions to talk more about what's going on with them. Closed-ended questions are opening that door to just yes or no, versus you want them to get up and say things and tell you about their day and tell you what's going on with them. Focus on the feelings of what led to possible use, not the reaction of using. What not to do if you're suspecting drug use. Do not accuse them of using. If you are not positive this is happening, all you're seeing is changes in behaviors, changes in eating habits, isolation, it might be something else going on. Do not tell everyone in the family what you think may be happening. This actually isolates the person more. And it also doesn't leave them feeling good about having someone in the family to go to and express themselves to. Do not yell and scream and criticize. This will push them farther from wanting to talk to you. Drug use is used as an unhealthy coping tool, so there are other things happening. Offer help. Offer to help them. Offer to find them someone to talk to, such as a therapist or a church. But be compassionate. Be compassionate but also firm in that you do not condone the substance use, but also want to help them find better coping skills for their situation. Remember, substance use is a reaction to underlying emotional issues that need to be resolved. Focus on what led to the use and offer ways to decrease the emotions and alternative coping skills. Alternatives. If in case a family member is using and feels they cannot stop on their own, please seek professional help with members' consent. It may be something they feel they cannot stop. Explore agencies in your area that offer substance abuse specialties and programs, as well as age-appropriate. Just remember, we cannot force someone to get help. They have to be willing to do that. Forcing does not make them want to stop, but increases their other negative feelings.